Headaches can change your life. If you're watching this video, you know that. And so can eliminating them. There's some answers you should know, like which pain medications cause headaches or internal bleeding. Some medications actually do. Why doing nothing could increase your stroke risk by 50%. Where to find the questionnaire that accurately identifies your cause. And the natural, proven solutions for your headaches that correct the cause and prevent it from coming back. Headaches don't have to change your life. So how do we find a solution? Well, all solutions come from a focus of time, money, and effort. That leads to an information, product, or service. There's different things that motivate or that focus people or businesses. There's money that comes from stockholders or just serving mankind. That's someone's motivation. Management, like managed care or management of a business. Managed care of insurance. Patient's interest. Money. Again. And time, money, health, comfort to enjoy life. These things motivate different people different ways. The manufacturer might be motivated more by money of stockholders, and the owners might be motivated by serving mankind. The doctor might be motivated by insurance management or management of the company. Of course, the patient's interests and money for feeding his own family. And the patient or the consumer is motivated by time, money, and their health and comfort, ultimately to enjoy their life. These lead to an effective solution, serving someone's interest or someone's focus. You need to decide what your focus is and which one of these is going to meet your needs best. So the focus of the manufacturer. Money from stockholders and serving mankind, perhaps, motivates the manufacturer, and they usually sell drugs to cover up, not treat the causes, like Viagra for sexual problems, Wellbutrin for depression, diabetes medications. Most of the research goes into lifestyle drugs, those that you'll need to take forever. That's not bad. That's just business. And it serves the needs of those who are focusing the manufacturer. Now, what's the focus of the typical consumer? Well, again, we go back to time and money and health. Well, health is scratched out here because really the typical consumer is not interested in their long-term health. They're interested in the short term. And if that results in long-term health too, great. And because they want to enjoy their life, they want to enjoy it now. Of course, we all do. And that ends up motivating the patient or the consumer as a money-spending consumer who says, I want pain relief now. No change in lifestyle, and I want relief now. And what's the focus of the doctor? Well, they're motivated by the patient or consumer focus, which we now know. Of course, it's obvious as we look around us. And they're also motivated by management or insurance. We see a picture of people with clocks on their heads, and too often this is the focus of management or managed care. Get them in, get them out. And that way they can save money and charge less for their insurance. And then there's the doctor knowledge base. If the doctor reads the latest research, if he goes to seminars, if he listens to drug representatives, and his experience as a doctor. All that ultimately results in the information, product, or service offered by the doctor. Now, more about the doctor knowledge base. This is from a text, now it's online, called the Merck Manual. Here we list some characteristics of headache disorders by cause. It's a very good text, and many doctors look at this to learn or to refresh their information about certain conditions. So again, you see the arrow pointing at causes, some characteristics of headache disorders by cause. And we have listed cluster headache, migraine headache, tension type headache. Those are not causes. Those are conditions or description of a combination of symptoms that name a type of headache. And this is part of the problem. Causes are mixed up with symptom groupings. And so then you end up treating not a cause, but you treat a symptom grouping. This is why traditional medical doctors rarely mention solutions other than drugs or surgery. When drugs or surgery are what you need, medical doctors are the best. Countless lives are saved by their quick thinking. But if you're looking for a natural solution to a chronic problem, drugs or surgery may not be the best tool to use. Don't ask a hammer to do the job of a screwdriver. It may get the job done, but it probably won't be what you're really looking for. So what's your focus? Time? You want more free time? More enjoyable time? Money? Want to save your money? Health and comfort? Health and comfort to enjoy your life now and in the future? That's what I want. This is what motivates most people. But is the health and comfort now and in the future that motivates you? Because all those elements don't motivate the typical consumer. So what is your solution? Now, why not focus on pain relief now and forget about it until the next pain? If you can get rid of it now, not have to worry about it, what's the problem with that? Well, consider the options of covering up the warning signal, because that's really what pain is. It's a warning that something is not quite right. Your body senses danger. Your brain thinks something is going wrong. And if you just cover it up, like covering up the warning light on your dash of your car, that won't solve the problem. Medication use can cause headaches. For example, amitriptyline, which is an antidepressant, sometimes used for migraines, seems to make your body lose vitamin B2. Okay, so what's the problem with that? Well, amazingly, vitamin B2 treatment cut migraine headaches in half for 50% of patients in one study. So sometimes the medications actually cause a problem or make a problem worse related to something like a deficiency here that could actually solve the problem in the first place. If you just correct the deficiency, you might solve the problem. But if you try to work on the symptom, you might make it worse. Medication overuse can cause addiction and headaches. Some of these medications cause brain chemical changes like sedation, mild euphoria, and stimulation. Well, that sounds good, but not taking the medication for a day or so may lead to withdrawal or rebound headache. The only solution? Take more drugs. It gets rid of the headache. But then if you try to go off, withdrawal or rebound again. The medication rebound headaches. What's the cause of these? These is just for people who take lots of medications, right? Well, this is from WebMD on their topic, migraine headaches. Exceeding labeling instructions, such as taking the drug 3 or more days per week, can cause rebound headaches. 3 or more days. So a lot of people with headaches take their medication 3 or more days. How common is this? Well, more than 40% of doctors who said they were interested in headache information say that 1/5 or 20% of their patients have rebound headaches, meaning they're caused by these medications. Medications that cause rebound headaches. Now, this is unusual medications, right? Not just your everyday. Well, listen to this. Sinus relief medications, sleep sedatives, codeine, Anacin, Excedrin, Bayer Select. If you have migraines, you might be familiar with ergotamine preparations. Butalbital, aspirin, Tylenol, or generic acetaminophen, and non-steroidal anti-inflammatories, which include Aleve, Motrin, aspirin, Dapro. These are pretty common. Especially notice the ones in the yellow here: aspirin, Tylenol, acetaminophen, Aleve, Motrin, aspirin. Aspirin gets put there twice because it's so common. Now these painkillers, NSAIDs or SAIDs, term I came up with the SAIDs, This is non-specific anti-inflammatory drugs and specific ones. So stomach pain, intestinal bleeding, ulcers, heart failure, liver failure. Wow. This is from the website fda.gov. Here we have non-selective and selective pain medications are worse than previously thought from the U.S. Food and Drug Administration website. The COX-2 selective and non-selective non-steroidal anti-inflammatory drugs. It says down below, potential life-threatening gastrointestinal bleeding associated with your use. That included things like Celebrex and Vioxx. Well, we know about that, right? Those were bad things. They're gone now. Sure they are. What about this? Manufacturers of non-prescription over-the-counter NSAIDs are being asked to revise their labeling to provide more specific information about the potential cardiovascular and gastrointestinal risks. So what are the over-the-counter NSAIDs? Well, let's go back and slide and find out. Aspirin, Tylenol, acetaminophen. Here were the non-steroidal anti-inflammatories. Aleve, Motrin, aspirin. Those aren't so uncommon, are they? So that was back in 2005. Now here's 2011. Pain and other medications are worse than previously thought. An FDA bulletin. Overdoses from prescription products containing acetaminophen account for nearly half of all cases of acetaminophen-related liver failure in the U.S., many of which result in liver transplant or death. So this is a new warning they put out. And you see these things: fever reducer, pain reliever, cough, sore throat, pain reliever, children's, age 3 to 4, pain reliever, acetaminophen. You have to be careful with these. So if no pain medication, then what? What are you going to do if you've taken away all the solutions? Well, remember, pain is merely the warning signal. So focusing on a symptom can be misleading. Examples compared to people with no neck pain. Listen to this. People with neck pain have more pain in their face and head. So is the problem in the face or the head, or is it in the neck? People with chronic neck pain after whiplash have more pain throughout their entire body. So you might start looking for solution to pain in your back or your leg. Is it a problem in your neck, or is it a problem in your leg? Is it a problem in your brain? Is it a problem systemically throughout your body? If you chase these symptoms, it can be very misleading and frustrating. So what really causes the pain feeling? Well, it's irritation or dysfunction of nerves, muscles, or vessels generating pain signals in the brain. And here we see an illustration of irritation in nerves, ultimately causing manifestation of symptoms. You feel pain. Your brain perceives it. So why does pain relief, or what does pain relief really solve? It only solves the perception. If you just solve doing nothing may not be an option either. Some patients with migraine, with and without aura, are at increased risk for